Hello, I am Aditi Dubey. Today, we turn to something often left unspoken in the fight against cancer, the mind. Because when someone hears the words, you have cancer, the impact is not just cellular or physical, it is profoundly psychological. Fear, uncertainty, guilt, hope, grief, relief, anxiety. All of these emotions, sometimes all at once, become part of a new reality for the patient, for their family, and for the very shape of daily life. And that's where psycho-oncology steps in. It's a field that recognizes cancer is not just a biological disease, it is a human one. And as Europe reckons, with rising cancer cases and longer survival, countries are beginning to ask a deeper question. What does it mean to truly heal? Germany has been at the forefront of that conversation. In fact, it was in Germany in the 1970s that the term psycho-oncology was first formalized. Since then, it has grown into a structured and evidence based discipline, one that treats the mind alongside the body. Let's break it down. Psycho-oncology provides psychological support throughout the cancer journey, from diagnosis to treatment, from supervisorship to end of life care. It involves counseling, therapy, family support, and coping strategies. And increasingly, it's being embedded directly into cancer care units. In Germany, today, nearly every certified oncology center is required to offer psychological support. That's not a luxury, it's a standard of care. Patients can speak with psychologists trained specifically in oncology. Families can attend therapy sessions to navigate fear, burnout, and anticipatory grief. Children of cancer patients, sometimes the quietest sufferers, are not forgotten either. This isn't just about feelings, it's about survival and quality of life. Studies show that patients who receive psychological support often adhere better to treatment, experience fewer side effects, and maintain higher emotional resilience. For those in remission, it helps them navigate life after cancer, which can feel disorienting and lonely even in good health. And when cure is no longer possible, we turn to palliative care. Let's pause here. Palliative care is not about giving up, it's about shifting focus from curing disease to relieving suffering, from length of life to quality of life. Germany's palliative care system is among the most developed in Europe. There are specialized inpatient units, mobile hospice teams, and home based palliative services. Pain relief, dignity, and emotional presence. These are central goals. Importantly, German palliative care also integrates the family. It understands that caregiving is its own emotional terrain, filled with tenderness, fatigue, frustration, and love. So, support is offered not just to patients but to those who stand beside them. And it doesn't end with death. Bereavement care is an essential part of the system, helping loved ones making sense of loss in a structured and supported way. But challenges remain. In rural areas, access to psycho-oncology services still lacks. Among migrant populations, there can be cultural barriers or language gaps. Unlike many parts of world, there is still stigma, the quiet shame around seeking help for mental health, especially in older generations. And so, Germany continues to evolve through digital mental health platforms, culturally sensitive care models, and interdisciplinary research, training oncologists to notice not just tumors but trauma. Because cancer is not just fought in the body, it is fought in memory, in fear, in relationships, in identity. And if we don't treat those spaces, we leave patients half healed. So let us ask, what does it mean to be well? To live even while dying? To hold joy while holding pain? Psycho-oncology and palliative care don't give easy answers, but they give room for these questions. And sometimes That's the most healing thing of all. I am Aditi Dubey, and this was episode 14. Thank you for listening with your mind and your heart.